Hello, everyone. I'm MIchele Dunne. I'm Director of the Middle East Program at the Carnegie Endowment for International Peace in Washington, D.C. I'd like to welcome you. Thank you for joining us for this discussion on Egypt faces the pandemic. Today's session is going to focus on the health and economic challenges of the pandemic for Egypt. We're going to have a discussion of about 30 or 40 minutes, and after that, we'll have time for your questions. So please go ahead throughout the discussion and submit your questions in the YouTube chat, and I will select from there and pose questions to the panelists. This is part of a three-part series. This is the first in three short seminars. Today's session, as I mentioned, focuses on the health and economic effects of the pandemic. The second session, which will be 1 week from today, will focus on the political rights and global challenges for Egypt of the pandemic. And the third session, which will be on Thursday, June 25th, is how the pandemic will affect Egypt's ability to address enduring challenges, among them population growth, Nile water, and marginalized regions and communities inside of Egypt. So we hope you'll join us for all of those sessions. Today, we have a wonderful panel to address the health and economic effects of the pandemic. We have with us Ayman Sabae, who is CEO of Shamsiya, an NGO focusing on community-based health solutions. He's also a specialist on health rights at the Egyptian Initiative for Personal Rights in Cairo. We have with us Ekdawi, who co-directs the Arab Watch Coalition and who has worked for more than 15 years in civil society monitoring of international financial institutions. And we have Tim Kaldas, who's an independent risk advisor and a non-resident fellow at the Tahrir Institute for Middle East Policy. Again, after our discussion, we'll turn to the audience for questions, so please go ahead and submit your questions in writing in the YouTube chat function. So I want to start with the health aspects of the pandemic. And I'd like to start with some questions to you, Ayman. An Egyptian health ministry official predicted this week that daily infections in Egypt could rise over the next month or so from the current level of something like between 1,300 and 1,500 infections a day to 2,000 or even 2,500 new infections daily. So where do you see Egypt in facing this health crisis? Is Egypt approaching the peak of infections, at least for the first wave of the pandemic? Has it already passed it, or where do you think Egypt is?
Thank you very much for this important question to start with. So let me first be very clear that any projections or any predictions done by the government in the current context are based on the numbers that are supplied by the Ministry of Health. These numbers rely on the sources of collection of these numbers are really the central lab in terms of the number of tests, how many of these tests are positive and such. And in the end, even in the statements and even in the press conferences organized by provided by the Ministry of Higher Education, he was very clear that any of the numbers that are given do not necessarily reflect the reality. And this is why they have different scenarios where they account for the actual numbers of positive cases to be from 5 to even 7 times the numbers actually provided by the government. So whenever we are dealing with these figures provided by the government, we should be very cautious. It's not that the government has different numbers that they are hiding, but these are the actual numbers available to them within the available tools for them to collect data. When we put into consideration the number of people who get infected and do not report or do not manage to report for whatever reason, for stigma, for fear that they're going to be receiving services in a place that may actually infect them, or because they simply don't want to give the data to the government, in the end, when we are dealing with this, we are fully aware that these do not represent the actual numbers of the infections. That said, I believe that we are approaching the peak of the infection. so far, the predictions of the government have been more or less accurate, again, based on the numbers that they are actually collecting. And so far, the healthcare system has been relatively resilient to the situation. That said, we were actually blessed by a relatively slow curve of the infections. This curve should have enabled us to actually be ready for the current moment. And it should have enabled us as a country with a system that is liable to collapse from such a pandemic to be more ready in terms of operations, in terms of information and management of the cases and distribution among the hospitals. And this is where the main problem is. Are we nearing the peak? I would definitely hope so. I believe we are. So far, the predictions were relatively accurate, but will we be able to maintain this with the least amount of unnecessary deaths and while ensuring that our healthcare system doesn't collapse? This is really the challenge that we need to identify and to address.
So let me ask you more about that, about the ability of the health system. You said the health system has coped reasonably well so far, but if these predictions are right, I mean, if you would be looking at perhaps a 50% rise in the number of cases coming in on a daily basis over the next month, do you think the health system will be able to cope with that as well?
Well, so far, in terms of hospitals and their capacities and number of beds and ventilators, we have not reached a saturated system yet. So far, we are not providing services that are optimal. This is why the utilization of these services is not necessarily in the best way. Many people don't go to the healthcare facilities simply because they don't trust in the system that is providing these services. So till now, we didn't reach the saturation. That said, we still are confronted with cases that go to hospitals and who are refused either testing or admission, not because they don't have enough beds, but because they are not managed properly, they're not distributed properly, they are not directed to the places where they will actually find the needed beds and the needed tests. And this is really where the problem is. I do not believe that we lack hospital beds or ventilators as much as we lack the system and the operations that can manage such a system. The healthcare system and the government has been pretty competent in managing the situation at the very beginning because it was contained, because the minister could have a daily meeting with the limited number of isolation hospitals that it has, and it could actually manage the case and be in direct communication. Now that cases are being directed to over 300 hospitals around the country, now that different healthcare facilities are providing different kinds of services, they definitely do not have this under the sufficient control that should have been in place.
So, one thing we've been seeing is a bit of public tension between medical professionals, for example, the Physician Syndicate, and government health officials. How do you understand that? What's the nature of this tension, and what does it tell us?
For me, this is primarily lack of governance and stakeholder inclusion. The main criticism that as civil society we have been providing to the government in the past couple of months was not related to how they're managing the situation or the measures that they are taking. It was because they still do not believe in the importance of social accountability, of including all of the relevant stakeholders. So doctors, in that case, and medical professionals are the core of the service that is being provided. And if we are managing such a situation without having a body that includes all of the different stakeholders, listens to them, and accounts to their needs and to the restrictions they have in the design, it is bound to have conflicts. This is why just a couple of days ago, the Chamber of Private Service Providers decided to announce that they are going to refuse to receive any services to receive any patients to provide them with services related to corona infections, because the government decided to impose on them a mandatory pricing that is making them lose from this equation. This could have been prevented by an early inclusion of these stakeholders in the equation. Doctors and their needs are very simple. They do not require negotiations. They do not require to be dealt with as an emergency or as a crisis. We have been blessed by a slow curve. So this is really the main problem. The government has done a tremendous job in containing the situation and in containing the pandemic at the beginning. It could have dealt with such a thing in an even better way if it had included the entire society. NGOs, private sector, doctors, all of the different stakeholders, they could have had a say, and they could have easily made the transition from different phases of the pandemic much smoother. We're still there. We can still contain this by driving by pushing for more accountability and more and the better governance of the decision-making process. The Prime Minister announced around a month ago, actually, that he wanted to reinstate the Higher Health Council, which is an accountability body that was designed to do this job, but has never been entering into operations. I think this is the perfect time for this, and we are heavily advocating for this, because this is really the only way we are going to get through this as a society, not just as a government.
Thanks, Ayman, and I'm sure we'll get back to more about the health aspects in the discussion, but I'd like to turn now to the economy. And, you know, as we discuss the economy, I hope we'll be able to cover both kind of the macro picture and the real economy, you know, how it affects people, because it does seem that, of course, there's a global economic recession related to this pandemic, and it's affecting Egypt just like every place else. So I'd like to start with you, Tim. So you know, as Ayman said, Egypt may be approaching the peak of the infections, at least for the first global wave of this coronavirus, but we still don't know how bad it will get. But what about the economy? I mean, it seems that just as infections are peaking in Egypt, Egypt is also starting to reopen for economic reasons. How do you feel like you have a sense already of how hard an economic hit Egypt will take from this global crisis, or will it be, you know, a long time before we know?
I think, thank you, Michelle, and thank you all for being here. I think that we have an idea so far what the accumulated effect is, but we can't reasonably or accurately predict the ultimate impact, because we don't really know how long this will go. And Egypt's economy is not isolated. So even with a slow curve, as Ayman mentioned, the global downturn that has been precipitated by this pandemic will affect various elements of Egypt's economy, from global trade to energy prices to remittances. Egypt has a lot of external vulnerabilities that are taking a hit due to the struggle that the entire world is dealing with. And that, coupled with a fairly fragile economic structure that's been built up over the years, that's dependent on a handful of pillars and a fairly weak and not terribly diversified private sector, but more weak than less diversified, has made it even harder, I think, to cope with this. And then on the real level, the infrastructure for providing social support to the public in terms of means-tested cash transfers, in terms of other direct forms of assistance, is still not sufficiently developed. And so, for example, when the government offered payments to workers in the informal sector, they reached a little over 10% of them, which is, it just is such a huge part of the economy, and they don't have even the records of who they would be giving the money to, and a lot of the people in that sector complained that they didn't even know how to get the money, or that they were eligible for it. And all of these things intensify the need on the part of workers to go out every day and seek any sort of pay that they can secure. and limits their ability to shelter in place and follow the guidelines that the state has placed to deter the transmission of the disease. So there's a lot of structural problems that became more apparent as a result of this and have exacerbated the economic losses that will come as a result of it as well.
So Tim, you just mentioned that the Egyptian economy sort of rests on a small number of pillars. So I'll just note that in addition, of course, to the general, slowdown of everyday economic activity as people are forced to stay home, these major sources of foreign exchange for Egypt, Suez Canal revenues, remittances from abroad, tourism, gas exports, they're all down, and they all might be down for some time. And it also seems that the central bank is again supporting the currency to try to avoid another real drop in the value of the pound. I mean, how do you see this picture? I mean, how long do you expect all these things to go on? And, am I missing other factors that are key to how this is going to affect the Egyptian economy?
No, I mean, I agree with you. I mean, as early as March, I was noting that virtually every single source of dollars that Egypt depends on is going down. And I don't see, a number of those will be that way for quite some time. Tourism is not going to recover quickly. Global trade I don't think is going to recover that quickly. Remittances are going to be a long-term problem as people are leaving the Gulf at the moment. We don't have a good breakdown by nationality of how many people are leaving, but Bloomberg ran a piece recently saying that as many as 900,000 jobs in the Emirates might be lost. Repatriation from Qatar is happening. We're seeing a lot of people leave, and that's remittances for Egypt was 9% of the GDP of the country last year. It's worth an enormous amount of money for the country, and it's also crucial to support so many families in the country who have been struggling to deal with years of punishing inflation and austerity. So a significant drop in that revenue is going to affect a lot of individual families significantly. But I think that what we also need is, as Ayman pointed out, in the health sector, we need more inclusivity. We need a much more inclusive reform policy and growth policy. I mean, Egypt's economy has been growing for the last number of years, and it's gotten a lot of praise for the growth and the reforms that it's done, but the private sector has been shrinking. The growth is not, and poverty has been increasing. The growth has not been going to the public. It's been targeted to a handful of sectors that enterprises close to those who rule the country control. And until there's a more even distribution that includes much more of the public, that growth is of limited consequence for the quality of life for the average Egyptian. I mean, since the bailout, 5 million people have fallen into poverty. Purchasing power is down 20% still. They've endured years of incredible inflation. So I don't know how much we can even call what's happened so far success, except for stabilizing their currency reserves, and their access to the private markets for selling debt, which collapsed immediately during this pandemic until the IMF stepped back in, and now they're starting to recover interest in selling Egyptian debt.
This is a global economic crisis, right?
Absolutely.
So, I mean, there's, I think that one of the arguments that I've been hearing people in Egypt making is that, well, the whole world economy is suffering from this, and Egypt is, all Egypt needs to do is to do relatively better, than other countries, than others in the region, and just kind of muddle through this, pull through this. Do you see that as viable, or these other factors that you've mentioned, a private sector that is not thriving as it really would need to be to generate the enormous number of jobs that are needed for the growing labor force, a rising level of poverty? I mean, do you see these things as kind of catching up with Egypt during this crisis, or do you think Egypt is going to be able to muddle through in a year or two, be not worse off than it was before it went into the pandemic?
I think the whole world's going to be worse off. I don't think anyone can avoid that scenario. I think that I mean, as you said, this is a global crisis. I mean, we're talking about Egypt, but I don't mean to suggest that Egypt's alone in this. I think that some countries are much more vulnerable than other ones in terms of their ability to finance a recovery and to stabilize their economies and provide for the public's needs. I think Egypt, because of its high, external vulnerabilities, is less resilient than a lot of other economies, and that's going to make it all the more challenging to recover. I mean, the IMF noted that Egypt might be the only country that doesn't see a drop in the value of its GDP. I think that might be a very optimistic reading given what we're witnessing. But I guess my concern is Egypt has to borrow right now. I don't disagree with that. I think that pretty much everybody does have to borrow in order to finance the recovery and their stabilization. The question is, how is that money being spent? And what kind of reforms will happen going forward? I mean, the newest IMF lending claims that it's supporting inclusive private sector led growth, which is what they said last time. And we saw the contrary take place. What are the new policies, or what are the new plans between the Egyptian government and their lenders, such as the IMF, the World Bank, et cetera, that are changing the dynamic going forward? Because I've yet to see any concrete details. And I've been asking for this, and I think a lot of people have been. Until anti-competitive practices are removed, until there is more breathing room for civilians and the public to participate in the economy and help build their own country, as opposed to this kind of paternalistic economic structure that we currently have, Egypt will continue to require assistance. Egypt will continue to require debt. Egypt will continue to have a foreign policy built on rent seeking. And these things mean that it will remain vulnerable and fragile going forward. If the goal of all of this is to stabilize the country on a sustainable path and eliminate this fragility, then these issues have to be addressed. If the goal is just to kind of put a band-aid on it and kick the can down the road for a few years, then sure, you can stabilize their reserves and their access to selling some debt on the private sector. And they'll be okay for a little while. I mean, Egypt had a buffer going into this, which is why, thankfully it's been, compared to a lot of possibilities, it's been relatively stable. But that buffer is all borrowed. I mean, and the next buffer is all going to be borrowed. And so until it can build up its own kind of more sustainable structure, I don't see us escaping that cycle.
Okay, well, thanks. You've actually gone where I was just going to go. So I did want to talk about the new International Monetary, Fund agreement. So as with many other countries, Egypt has gone to the IMF for help. So it's already gotten a $2.8 billion emergency loan. That one did not have reform conditions attached to it. But now it is poised to get a $5.2 billion standby arrangement. From what we've heard, this would be a one-year loan dispersed in 3 tranches. And it's also, Egypt also is trying to raise at least another $4 billion in external financing from other sources, among them the World Bank, African Development Bank, perhaps JICA, Japan, or some other sources. So we're looking at Egypt for sure needing $10 billion or more in external financing, I think, in this calendar year. So Amy, thank you for being patient. I want to turn to you with some questions. And then, by the way, I will want to bring Ayman and Tim back in on this IMF program as well, because I think this is an important moment for international engagement with Egypt. So, Amy, you have a tremendous amount of experience looking from a civil society point of view at international financial institutions such as the Fund and the World Bank and how they engage with Egypt and other countries in the region. How do you see this new IMF program? Are you concerned about the level of foreign debt that Egypt is taking on, or do you see it unavoidable? And what should the IMF? These will be mutually agreed conditions between the Egyptian government and the IMF. What should they be in order to put Egypt in the best situation from both an economic and as from a socials, from a society point of view to weather and get through this pandemic?
Okay, thanks, Michelle. Like Timothy, I'm not concerned. Okay, I am concerned about the loans, but they are unavoidable. It's like this is the situation we are in, and most of the countries now are seeking loans to survive. So I'm concerned, but it's unavoidable. So just to mention that so far in the last few years, Egypt got 3 loans from the IMF, and from the 3, the IMF has 3 types of loans, and all of the 3 types of loan Egypt got so far. So the first one was from extended credit facilities, the one that 12 billion, and then the one that was 2.8 that you mentioned, the emergency funds. This was from another instrument called the rapid credit facility, and this is the one that just like for urgent need without conditionality. And this one is the stand credit facility that is coming. Actually, this is a golden opportunity for civil society to work with the IMF here, or to put pressure on the IMF to act on their own discourse. Because in all the IMF evaluation or Article 4 or even the report on that $12 billion, I always mention 2 areas of concern. Structural change in terms of governance, transparency, participation, and also like the state economy that is overcrowding the private sector. And by state here, in I guess in one document, they mentioned it's military, but even in the other documents behind closed doors, they would say this is what we meant. The military is overcrowding the private sector, and this is not good even to create jobs. So they recognize those things. It's just like they need more pressure to enact on this discourse. And that's why it's golden opportunity for us to be engaged and ask them to act on this, not only to put it on paper. So this is in terms of the IMF, but I also want to talk about the World Bank, because the World Bank actually has entry points for us to be engaged. Like the IMF doesn't have those entry points. There is no mandatory policy in the IMF to consult with civil society. There is no mandatory policy in the IMF to ask the borrower to engage with civil societies. I will just take about more governance, some measures and the structure change, but the World Bank has those entry points, and those are the entry points that we should use. So just to give an example, the IMF gave a loan, and they have something called the fast track loans facility, and those are loans that are quickly approved before doing all the due diligence. And it's a 50 million loan that went to Egypt for health to deal with COVID-19. The detail of the loan, the program, are online on the World Bank website. The World Bank, under this specific type of loan, they have mandatory policy called stakeholder engagement plan. And this is exactly what Ayman was talking about. When they didn't engage early on with doctors and with owners of the private, it's a mandatory policy in the World Bank. And this plan, the stakeholder engagement plan, is also posted online, and it has details each component in this loan. This component should have this specific amount of money. And this is why we always call on civil society, please look at those documents. You have the right. The government would submit a report that they had engaged and they complied. But most of the time, we don't know if those reports are true or not. And if there is violation on this mandatory policy, we can submit official complaint here and make things happen. And this is golden opportunity for us now. And in terms, because you were talking with Timothy about what would be the long-term impact on the economy in Egypt, Just to mention, the World Bank was just before COVID-19 had started its process to develop a new country CPF, country partnership framework. This is like the strategy framework for the World Bank engagement. They have started working on this. The first step is systemic country diagnostics, which is as the name says, it's a diagnostics for all the opportunities and obstacles to achieve the development objectives. They have started working on it secretly. Nothing posted on the website, even though it is mandatory policy that those things should be public. They should be engaging with civil society. It should be, civil society should go to the World Bank and be engaged with the government there. I learned because I have sources inside the World Bank. Anyway, everything now is on hold. And when I asked why it's on hold, they said because we don't know how it will end. So we will have new realities after COVID-19. So we cannot work on this. But we are keeping an eye because as soon as they start, we need to be at the table. This is our right as per the World Bank policies.
Thank you, Amy. That's really a great education in how civil society can engage with these institutions. So as you've said, the World Bank and the IMF have different mandates, and there are different kinds of conditions or reforms, that they could try to make conditions for loans. So let me turn it again to Ayman and to Tim. Ayman, I want to ask you, I guess, particularly about the World Bank and about this issue of community engagement and stakeholder engagement in health policy. And of course, you're free to comment on anything else. And then maybe Tim could say a little bit more. You already started about the IMF, and about the IMF, of course, has more in its mandates. It's more economic and fiscal, so forth. What the kind of things they can ask for. So the question is, what should be on the table at this point as Egypt goes to the international community and the other institutions as well, the other banks and so forth. What should be on the table? What would be the most helpful reforms that could be made? Ayman, let's go to you first.
Sure. So yeah, I mean, as Amy and Timothy mentioned, these policies and these recommendations, whether it's from the IMF to a lesser extent or from the World Bank, about governance, transparency, and participation, they have always been there. And for the World Bank, they have even reached the level of, in the last loan, I believe, it was even stated as tranches of the loan. So for example, in the healthcare service component, you had in it specific indicators and requirements for the creation, for example, of a grievance redress mechanism, which is basically that hospitals and healthcare service providers needed to have a system where patients could complain, and then they would receive a feedback on these complaints, and investigations would follow and such. And the funds of the World Bank were to be allocated in terms of the number of complaints that were received and the number of complaints that got responses. And each tranche of those were actually associated with a financial component in it. So this has always been advocated for, and even in some cases linked to funds. The major problem is that the government in Egypt always perceived these as things that were not tangible. These were the small obstacles they tried to, get rid of and do in the least, in the most acceptable kind of way, with the least amount of effort, because they always felt that these things did not match the mentality of the Egyptian people. There was this idea that Egyptians, they don't really care about having a complaints mechanism and accountability and having a seat on the table of the decision-making process, because they're not either educated enough or they don't have the knowledge about these democratic processes. For them, these are very cosmetic things that don't necessarily have an implication on the ground matters. Now, with the current pandemic, we can clearly see that these things actually end up making a major differences in how healthcare services are provided, and how policies function and whether they succeed or not, and how the community engages with these policies. The reason why people end up going to hospitals at a late stage and therefore increasing the rates of deaths from infections because they were admitted at a late stage is because they don't trust the service providers primarily. The reason why they don't trust it is because they don't feel any sort of ownership in there, and they don't necessarily believe that these people will be able to treat them in the proper way. And this is why they only go when they absolutely need to in the end. And this is why this is, like mentioned, a golden opportunity not also to hold the government accountable to do this because it is linked with international funds, but because we now have and we can collect evidence that this actually works, that having these people on the table makes a difference, that providing solutions that are integrated with the healthcare policy reform that is undergoing, like the health insurance law, for example, or something like having patients' rights charters, or citizen monitoring mechanisms. We've been involved in numerous initiatives that allow people to monitor the quality of services provided in hospitals, or even recently with the latest outbreak, to allow people to monitor the infection control measures provided in public places. Promoting these things and engaging society in a way that capitalizes on this societal innovation is the key to move forward, not just because it's linked to funds from international donors, but also because it makes a difference. And this is what really makes society as a whole capable of dealing with the pandemic.
Amy, I think you'd like to comment.
Yes, I want to agree with Ayman that those type of mandatory policies have always been there, but to a certain degree, not as strong as in this last loan, the emergency loan. Like the health system loan, the big one that has been going on for years now in Egypt. It's a different type of loan that's called P4R, Program for Results. So it has some mandatory thing, some component for citizen engagement, like the grievance mechanisms. But this last one, it's from another instrument. It's a loan from another instrument. I don't want to go into technical. And there is a new policy that applies to this instrument called stakeholder engagement plan. And it doesn't only about the grievance or consultation at the beginning, but it should be planned from design to evaluation. And it is mandatory that the government should report to it. And it's also mentioned for the first time in the agreement. That is like have a legal value between the World Bank and the government. So I really want people to look at this document because it's on the World Bank website. I am sure that it's not implemented as it said. And unfortunately, the government, as Ayman said, they always find their ways to work around it. But now this being a policy gives us the right to go and officially complain if we know that the government is reporting something that didn't happen as it should be.
Thanks, Amy. Okay, Tim, I want to ask you about, this issue has come up about the IMF and this issue of military companies sort of tilting the playing field economically in Egypt, disadvantaging the private sector, moving into certain sectors of the economy very strongly. As Amy mentioned, in at least one of the IMF reports, they had a sentence mentioning this, although it's something they're often very shy of talking about publicly because they know it's politically sensitive. What's your point of view on this? I mean, what would be, are there things that the IMF could try to work with the Egyptian government on that would help to give the private sector, a better chance and address this very hot topic of military affiliated companies and their involvement in the economy?
I mean, I think that I mean, it's very politically sensitive, and the IMF is reluctant to openly engage with the issue. And I think that they're afraid that, frankly, if they were too forceful, the Egyptians would refuse to deal with them. But they have more leverage now than they probably ever have, because Egypt's in need of financing and kind of hard pressed to find it. I guess the issue is multifold. One,
Tim,
that are owned by officers outside of the military. So there's been a fixation for the last, say, 25, 30 years about state-owned enterprises and privatization and liberalization as a way to kind of free the market and make it more competitive. What they've done instead is establish a set of regime-owned enterprises, if you will. So you have, even if you privatize state-owned entities, they're still captured by the regime. And so the political intervention in the economy persists. And you don't actually have the kind of more diverse distribution of economic activity and economic actors that you were pursuing. Even now, the president has talked about listing some military companies on a stock exchange, but this kind of turns the military almost into a sort of private equity firm in which it builds up companies, sells equity to raise capital, to then expand its own economic empire, as opposed to allowing for public participation in the economy on a more even playing field. So, I mean, if the goals should be about promoting three complementary and compounding elements: inclusivity, resilience, and sustainability. And that means that there should be an even playing field for inclusivity that allows for example, if the company is owned by the military or another security apparatus or the private sector, it should be subject to the same tax regulations. It should be subject to the same customs rules. It should be subject to the same regulatory frameworks, because all of those competitive advantages for regime-owned enterprises deter investment, both from the private sector and from foreign, and in terms of foreign direct investment. The idea of competing with the ruling apparatus on this very uneven playing field is highly unappealing to many investors, unless they're working directly through the regime-owned enterprises, through partnerships, for example, because then they get to reap the benefits of those advantages. But again, that fails to provide for this kind of more diversified economy that presumably we're going for. So inclusivity, though, beyond just allowing for private sector companies to compete fairly, involves something that the IMF has talked about a lot, which is, but we haven't seen enough progress on, which is addressing mitigating the impact of all of these reforms on those most vulnerable. So that means that the means-tested cash transfers through Takaful and Karama need to expand dramatically. Currently, roughly 1/3 of the Egyptians in poverty are receiving those benefits, leaving 2/3 without any cash assistance. And that's a huge problem. The infrastructure for delivering social assistance needs to be much better developed. And they did a good job at the beginning of rolling this out and adding people to the program, but it slowed down substantially after the first couple of years. And we really need to recommit to expanding it so that every Egyptian in need has access to it. And that social assistance has a direct economic benefit, because the purchasing power of Egyptians is central to the economic appeal of the Egyptian market. If the selling point for Egypt for quite some time has been, it's an enormous market. You can sell to so many people. Well, if those people don't have any money or any purchasing power, then it's much less appealing than it used to be. So empowering people with cash in hand is an important tool to put in their hands beyond the social benefit of it. That inclusivity in terms of allowing the private sector to participate fairly, putting cash in the hands of the Egyptians, compounds into resilience, because the more diverse the economic actors are, the more diverse economic activity is, the more resilient the economy is. So it's not dependent on any one particular pillar that an external shock could knock over. And that resilience translates ultimately to sustainability. And what's really crucial here is that if all of these private sector actors are playing fairly, and all of them are now taxable entities, then the government can focus on raising revenue by actually managing tax policy, as opposed to appealing for foreign assistance and other activities involved in rent seeking, or regressive tax policies like the one that was supported by the IMF last time, the VAT, which I understand is the easiest tax to roll out, but hurts the average Egyptian, increases inflation at a time where there was already a serious risk of that, and ultimately leaves the state with underdeveloped tax institutions that are crucial for stabilizing a sustainable path forward that doesn't require emergency international assistance on a regular basis. So inclusivity, resilience, sustainability, each one helps contribute and lead to the next. And if your policy package and your reform program doesn't center those three elements, then we're going to keep having this conversation indefinitely. And we've already been having it for a half century. So maybe it's time to kind of refocus the conversation.
Thanks, Tim. We're going to turn now to the questions from the audience. And please, I have a number of questions lined up, but participants feel free to go ahead and submit more through the Q&A function there. So the first question that I have, I'm going to put two questions together, and they're for Ayman. So these two questions: does Egypt have adequate diagnostic capacity to monitor and assess the spread of the disease? What are the available diagnostic tools? How are they managed? And what is the reason for the government insisting that COVID-19 testing be done by government labs?
That's a good question. I wish I had an answer for, but yeah, the thing is, so according to the statements given by the government, we have PCR kits, we have rapid testing kits, and we have, of course, CT scans and such. And tests are done following a protocol that is presumably followed by the government to make sure that the right investigation is done at the proper time and the proper progression of the disease, following the recommendations from the WHO. The major problem that we have in this case is that, first of all, we don't have an official reporting on the number of tests that is being carried out on a regular basis. We hear about this every now and then, so every month or so, maybe in a press conference or a quick statement like this, or for example, when there was a conflict between the medical syndicate and the government, then they began to announce some of the numbers of tests carried out for the medical teams. But other than that, we don't receive a daily or a regular account of the number of tests. The second problem is that, in my opinion, people who seek the investigations, usually the reason why you need to know whether you have a positive case or not is to be able to properly manage the case and to properly treat it in a way, and also to prevent the spread of disease. As the pandemic has progressed and as the numbers have steadily been growing, the policies of the government regarding this has been also adapting and changing accordingly. So at first, if you were suspecting an infection, if you were exposed to previous cases, you would call the government hotline, and they would actually send you an ambulance that would take you for a test. And then within 12 hours, they would tell you the results. And if needed, you would get isolated. Isolation was carried out in isolation hospitals, in fever hospitals, and even in youth hostels and university dorms that were specifically designated for this purpose. Now, this is not the case anymore. Now the protocol has changed. Now we're talking about home isolation. Now people are beginning to be supported in getting management and treatment within the settings of their own places rather than going to hospitals. So the management of the situation has differed. And so the capacity of the government to carry out tests for everyone has definitely decreased tremendously. I don't know if this answers the question or not.
Thank you. Let's see, I have an economic question here, and I think probably this will be for Tim. What happens to the Egyptian pound if all the primary sources of hard currency, remittances, tourism, gas exports, Suez Canal, are impaired for the long term? And is the Egyptian pound overvalued right now? Unmute yourself, Tim.
Sorry, that's a good question. It's one that we're all asking. In a floating currency market, in theory, a huge loss in dollars for emerging markets would mean a devaluation for sure. And we've started to see very recently some slide in the value of the Egyptian pound, which is to be expected. The fact that we saw massive outflows and no shift in the value of the pound for quite some time suggests that it continues to be managed. And we've had other indications of that over the last, I would say, 2 years. More than 2 years now. Yeah, so the latter half of 2018, it was pegged more or less unofficially through some mechanism with large state banks. Reuters uncovered that the central bank made a statement that now we've removed this repatriation facility, so expect more volatility, and then it's just been going steadily up in value ever since until this pandemic struck. And there's been a very big debate to what extent the increase in value is real versus managed. And some people think that the inflows of dollars, not because the economy is growing, but because Egypt is having so much success selling short-term debt, has allowed for the currency to gain all this value. Other people think that those inflows are insufficient for explaining the extent to which it's gone up. I am not an expert in econometrics, so I'm not going to venture an opinion on that. But what I can say is that I look at any FX value in Egypt with a lot of skepticism and suspect that the central bank is playing a role in at least stabilizing any movement in the currency. So it's not totally subject to market forces for sure. Regardless of whether or not it was overvalued at the beginning of the year, it is certainly, based on all of the things that are happening, it would make sense for it to decline in value going forward. I don't expect it. I expect it to go down in value throughout the year, unless they decide that they want to peg and protect it. But at some point, that becomes unsustainable, and it'd be better to allow it to do so gradually than to protect it for a long time, as they did in the past, and then allow a sudden drop in value, which not only does it create a shock in terms of inflation, it also undermines public faith in the currency and encourage dollarization. If people are constantly seeing collapses in the currency, they won't trust it. If its fluctuations are more modest, then they can get used to that sort of thing.
Thanks, Tim. I have a question here that I'd like to pose to both Amy and Ayman, because it's related to civil society. So to what extent has the medical syndicate looked to civil society as a partner? It seems like they might be natural allies. So let me ask Amy that first, and then Ayman. And Amy, I also wanted to ask you to comment on something that Tim said earlier about takaful and karama, these government ways of doing cash transfers to poor members of the society. Tim, I think, thought they were successful, but much too small in scale. Since you work so much with civil society, Amy, could you comment on that, and then also on the medical syndicate issue?
Okay, thanks, Michele. I can't comment on the medical syndicate because I don't know, I don't work with them. But as for the World Bank, civil society that they have to engage with includes syndicates. So it's in its larger term. So syndicates are recognized as civil society and represent stakeholders that should be at the table from the design phase early on, according to the policy. In terms of the other question, sorry, can you repeat it again?
This was about takaful and karama. It's it's about how successful you think they've been, and whether you think a big expansion would be a good way to increase social protections.
It depends. I haven't worked directly on it, but I heard different things. So if you ask the IMF and the World Bank, they have wonderful reports, and this is the most successful program ever, and it should be repeated in other countries. But from the point of view of international NGOs, civil society organizations working on IFIs, we have been always critical of designing the economic program and then at the end attach to it something for safety net. And we always recommend that from early on, when you design the economic program, this should be a component in the economic program, not an attachment. Like how you look at the vulnerable groups and include them in the economic programs, not at the very end, after you finish everything, you put an attachment here.
Okay, thank you. Ayman, what about the issue of the medical syndicate?
Well, Okay, so first of all, we need to understand a little bit about the dynamics of how the medical syndicates work. This is actually a very bureaucratic entity. It is not uniform. When a statement is produced by the syndicate, it requires the board of the syndicate to agree on it, naturally. And in the end, this is an organization that represents young doctors who are, in most cases, employees in hospitals, and senior doctors who are, in most cases, the employers and the managers of these facilities in the end. So it's quite difficult to really reach a consensus about any statement or any position in there. That said, with the current pandemic, there has been an increasingly alarming outcry against the protection needed to be done for the medical teams, be it in their working environment or in their treatment and management of their cases if they got infected, or even in terms of their financial remuneration. The syndicate hasn't really been on the table of the decision-making process during this pandemic. And this is a big defect. When the Prime Minister announced its willingness to create a High Council for Health to be able to have certain governance to the decision-making process, the syndicate actually submitted a counter proposal or some suggested modifications to the proposal for the new law that was communicated, which included in the formation of this structure more seats to the syndicate. And that's it. No civil society, no other stakeholders, no patient groups, no nursing syndicates. So in the end, it's of course, it is extremely important for the medical doctors to be represented in there, but they're not the only parts in this equation. And this is why it is extremely important at this stage to look at the current situation as one that requires a whole of society approach. We are not going to be able to go through this if we don't include the different parties in there. Civil society is receptive to any needs or any requests submitted to it by the government or by service providers. And even the private sector, by the way, there have been numerous attempts, and we have seen even the government thanking civil society and the private sector for the kind of donations and support they're trying to providing. But we need to understand that this has never been done because the government asked for something. It was always something that civil society or the private sector thought was needed. But the government never communicated what they actually need. Do we need personal protective equipment? Do you need ventilators? Do we need plans for field hospitals or makeshift hospitals? This was never communicated. And this is really the problem, that if we don't integrate society, either by the government or the syndicate or any service provider, it's not going to work. We need to be able to embrace innovation. And the way to do this is first to ask for what either the syndicate or the ministry needs, and to be able to receive it. The kind of impact the demands of the syndicate can achieve if it is actually coupled and pushed by civil society and the private sector would be completely going into a different direction if it is in comparison to something that is only promoted by the syndicate, in my opinion.
Thank you. Ayman, let me stay with you because we have a couple of questions from participants that frankly, paint a bit of a darker picture of the medical situation than you have. One questioner, for example, says, several people have told me hospitals are flooded, patients waiting for hours without a ventilator or even a doctor seeing them. Is this just poor allocation of resources, or is capacity reaching its max? And let me give you the other question too, is about death rates. Why are death rates in Egypt, it seems, although as you said, the numbers are very, the latest numbers that I've seen are something like officially 38,000 plus cases 1,300 or so deaths. But the question is this: why is the death rate of corona cases recording in Egypt currently one of the highest in the Arab region and Africa? So
Yes.
what would you say about these two questions?
So let me actually start with the second question, and I will add to it like a mini answer to one of the questions that I actually seen regarding a rumor that was being communicated that the number of people who actually signed up to be donors for the new plasma treatment policy, which means that they have positive cases, is actually much more than the number of actual cases reported by the government. So first of all, the mortality rates are significantly more accurate than the number of people who get infected, because the government is following in its reporting of deaths a protocol that accounts for the different variations in there, and that is significantly more accurate. So we look at mortality rates more seriously than the number of infected rates. This is why we have a higher rate of mortality, because first of all, the denominator, which is the number of infected cases, is incorrect. And this is directly stated by the government, and we know it. So this is the first reason. The second reason is that people go to hospital at a late stage. Many of the deaths that were reported by the government, according to the government's own statements, arrive at the hospital when they are already in a terminal stage, or even in many cases, they arrive to the hospital after the death has occurred. So this is why we have a relatively high mortality rate. Now, to answer the first part of the question, which is, are we actually maxing out in terms of our capacity? Again, governance. What do we know? What is actually stated? According to the government's direct statements, we are not at the maximal capacity. And since Egypt has an enormous physical infrastructure, at least, of hospitals and hospital beds and such, we do not believe we have reached this level either. But the major problem is management, medical personnel, allocation of resources, and actually having a central unit to make sure that a patient would know where to go if needed. We have received reports of people calling the hotline because they're suspecting an infection. Then the ambulance would arrive, and they would tell them, you know what, we cannot transport the case. You have to carry them on your own because we do not want the infection. Then they put them in the ambulance. Then they go to the hospital. And when they go to the hospital, that is normally part of the plan in a way, they end up not receiving the service that they get. The ambulance, which is a government entity, has been transporting them to another government entity, which is the hospital, without knowing that this hospital doesn't have this capacity right now to receive this case or to do this investigation. So this is what I'm saying when it comes to management and to being able to direct people in the proper way. Who needs the government? And to answer your question, why has the government actually not? Why have they been very strict about which facilities do the tests? Why is it only the government that does the test in the end? At first, it was about making sure that all the cases are properly reported and that they have the source of information regarding the cases. As the disease has progressed and as the rates and the numbers of infections have been steadily growing, the government needed to create systems that would allow it to expand the number of tests that are done, to go beyond its own labs, but also to make sure that they are reported in the proper way. Governance, inclusion of the private sector, including of labs and civil society. In the end, this is how it works. I don't believe we have reached our maximum level, but we look and seem to be reaching that because of the poor management of the current situation. The number of cases that we know is not, or that is being reported by the government, is not the most accurate one. This is why we have a relatively high mortality rate, and people actually face severe problems in accessing the services that they need, so they end up going late in the end. These are impending problems that we have been suffering from in terms of our healthcare system even before the pandemic. Our hope was that the time that the coronavirus has allowed the government to actually be agile and innovative in the way it addresses this has not necessarily been sufficient for them to act swiftly in addressing these reforms. And this is why civil society is interfering. I'm personally managing an initiative where we actually direct people to tell them where they can get the service, not specifically to Corona, but in general. We have, according to the Health Insurance Organization, more than 50% of the population officially insured. But when we look at data from the Demographic Health Survey, for example, you can see that only 8% of the women who have been who are actually entitled to health insurance actually use its services. The rest, they either don't know, they don't trust in the quality, or they get lost in the bureaucracy. So we have a systematic failure in making sure that people are accessing the services. And this is a role civil society can play an immense role in, without creating parallel tracks, without building new hospitals. If the government at some point feels that, or according to its figures, it has reached the maximal capacity, it can build 2 or 3 hospitals, makeshift hospitals, in a limited amount of time with 300 or 400 beds, and it will be able to easily address this. But in the end, it's about management. It's not about resources, in my opinion.
Thank you, Ayman. We're down to our last, 5-7 minutes here. I'm going to bundle together a few economic questions for you, Tim, but I also want to, we've had one very core question that's been submitted, and I want to use this to end with. So I want to give all the speakers a heads up. And this is a question that comes to us from someone with the Hands Along the Nile Development Services. So that question that I think we should end on is, what should be the core agenda items for Egypt while recovering from COVID-19? Okay, so I'll give you all a chance at the end, just 1 minute, to say what you think the top agenda items are. And here, of course, we're talking primarily in the health and economic sphere. Tim, as I mentioned, there are a bunch of different economic questions. I mean, one of them, just sort of points to the government's difficulty in trying to, to impose some sort of limited lockdowns, while trying not to hurt vital sectors such as real estate, and I would add tourism there. What about also, there's another question about the mega projects, such as the new administrative capital. We've heard that the government agencies moving there has been postponed. Do you expect that the economic effects of the pandemic are really going to slow down those mega projects, and what effect does that have? And then there's another question about the informal sectors. Sorry, I'm just trying to find that question, and whether we're going to be seeing, will we see changes to illicit economies such as smuggling, illegal arms sales, terrorist financing, and so forth as a result of this? So if you could, answer a few of those questions, and then we'll give each of you a moment to say something about what you think the key agenda items should be for Egypt right now.
Okay. So, I mean, I think that we're, with the new administrative capital, for example, the delay is to be expected. There's been a slowdown in construction activity in general. There's been an effort to maintain some movement on that, but not on the same scale as existed before the pandemic. So that delay is to be expected. The pace of recovery in terms of finishing that project is going to depend also on accessing financing and the appetite for people buying property in that area, because a lot of the development there is a cash flow issue as well. If people aren't speculatively buying units, then there isn't enough cash with developers to continue their projects. So it's kind of hard to predict that, depending on how this kind of plays out in the long term. With respect to the government trying to balance lockdown with the economy, yeah, I mean, this comes back to the issue of inclusivity and resilience that I was getting at earlier. Without a proper infrastructure for social support, it's very hard to tell people stay home. Without a mechanism for getting cash in the hands of people safely, it's hard to even distribute benefits you'd want to distribute. There was a problem where people were showing up at post offices in large crowds to get the the 500 pounds that informal workers were being offered. Most of the country doesn't have a bank account, so transferring funds that way is not really feasible. There's a lot of infrastructure problems in terms of social assistance that exacerbate the challenge for the government in terms of needing to keep people home at the moment. And then poverty, of course, compounds all of this with a third of the population in poverty before the pandemic, and who knows how many now. There's an urgency for so many of those people to work every day. And so telling people stay home or reduce your economic activity or reduce going out and using public transportation is borderline impossible, which is why while some people were calling for a more comprehensive lockdown, including many medical professionals, that I don't think was something that the government was prepared to pursue. And I think the slower curve deterred them even further. They kind of took a little bit of comfort in that. Because at that point, you'd have to be distributing assistance directly to the entire population, or much of it, because while a third of the population is in poverty, around 60%, according to the World Bank, is very close to poverty or below poverty. So you have a huge number of people who just simply cannot survive for any duration of time without going to work. So yeah, these structural issues that frankly plagued Egypt before all of this have exacerbated the challenge for the government. I would say that on certain things, they acted very quickly, like shutting down schools and universities, shutting down tourism, which is something they definitely didn't want to do. They shut down the airport in mid-March. I know because I flew out the day that they did. So I'm very sure about that. I mean, compared to even the United States in that respect, they moved quicker. But yeah, on other things, there's been a lot of critical debate about the lockdown, about loosening the curfew during Ramadan to accommodate iftar. I don't really, from an economic perspective, I don't understand it. Economic activity in Ramadan is already down anyways. I understand people would like to have iftar with their families, but if you ever had an opportunity to minimize the cost of reducing movement, that was the time to do it. People could stay home at night, skip the group iftar, skip the possibility of becoming, a new cluster, and ride this out, as opposed to now we have a stricter curfew after Ramadan than we did before, which is the current situation. So I would have taken a different approach personally, given the priorities that the government was dealing with, the resources available. But it's not my call, obviously.
Tim, just on the final point about what should be the core agenda items. I mean, you've made an argument here for, in looking at the economy, inclusivity, resilience, and sustainability. Is that your agenda for the core items for Egypt, or do you have anything else you want to add?
No, I mean, my argument from the beginning has been that the pandemic, while it has unique elements, has also just exposed the more structural problems that we've been talking about for a very long time. And this crisis for Egypt, and frankly for a lot of countries, including our own, the United States here, is an opportunity to really to see very clearly where the problems are. Like, for example, in the United States, health insurance being tied to employment has obviously not worked out well given the unemployment figures. But it exposes and shines a very bright light on the problems. And I think given how much financing will have to be brought to bear to recover anyways, let's try to allocate it in a way that allows for a more inclusive and resilient economy that is sustainable. And I think that, I've outlined some of those things here today. I've outlined more of it in my writing. And I think that needs to be the focus of the conversation. And there are many different ways to do that. But I think that focusing on those objectives is crucial to Egypt being on a healthier path going forward, both economically and in terms of health.
Thank you, Tim. Amy, how about you? What are your core agenda items for Egypt as it tries to come through this pandemic?
I agree with Tim that the COVID-19 crisis was really a golden opportunity to highlight all the defects that we have in the system, and now we need to evaluate what went wrong. So, for example, Ayman was telling us a lot of stories to highlight the mismanagement of resources. It's not the lack of resources, that's the mismanagement, and something needs to be done here. So I guess a governance issue and good management of resources should be the most important topic, and we have golden opportunity, as you said, Michele and Tim, that now Egypt needs those international institutions, and we can really exercise pressure on them because they have leverage now more than ever.
Ayman, your thoughts on the core items?
Yeah, I mean, I definitely agree with all of that has been said. I would just add to it integration. So integration with the current plans, integration with the health insurance reform program. This is a golden opportunity for this to happen. Promoting participation and shared ownership, promoting the role of civil society and private sector and society and communities and localities in this equation. This is extremely important now more than ever. And embracing innovation. And what I mean by embracing is innovation is first to ask, so to say, hey, dear civil society, dear private sector, we are facing this problem. What can you do to help? And then to actually be able to receive, to be able to provide these services the space that they need to actually present the kind of solutions that the government is needed. And I think this is really what a whole of society approach means in this context.
Thank you very much. I really want to thank all three of you, Amy Ekdawi, Tim Kaldas, and Ayman Sabae, for what I think has been a great discussion. I've really learned a lot. And I want to thank all of our participants and remind you, this is the first of 3 sessions. This is a 3-part series on Egypt Faces the Pandemic. And the session 1 week from today on June 18th will deal with political and rights and global foreign relations aspects of the pandemic. And then the 3rd session on June 25th will deal with some of Egypt's enduring challenges, population growth, Nile water issues, and marginalized regions and communities. I hope you'll join us for all 3 of these. Thanks very much for being with us today. I apologize to those whose questions I couldn't get to, but please come back and engage with us the next 2 weeks. And thanks everyone, and have a good day and keep well.
Thank you. Thank you, Michele. Thank you, Tim. Thank you, Amy.
Thank you. Bye.
Bye-bye. Have a good day.